In this video we will show you how rapidly melatonin levels decline as we age, and by the time we get 55 years old, there is basically not much left. Likewise, we will show you a number of diseases that actually very often occur on a low melatonin level. Coincidence? If you have been following this channel for longer, then you know that melatonin has been around for billions of years and that it is the protector of all life, humans, animals, and plants alike. Watch this video till the end and subscribe to the channel and see how even HIV victims run low on melatonin, and how a doctor had very good success with HIV patients, giving them 200 milligrams melatonin suppositories. Let's dive right into it. Can you imagine that such a thing like hair loss comes very often along with low melatonin levels? Meaning, very often people who have hair loss, they tend to have also low melatonin levels. Exactly, this is the case, as this doctor from Germany reports. His name is Dr. Hartner, and he is just another expert on the subject of melatonin. He treats his patients with melatonin and says that most of them have an urgent lack of melatonin. There is a widespread lack of melatonin as there is a widespread lack of vitamin D from the sun. Most of our pineal glands are no longer working. In the following we will show you some PubMed research papers, which demonstrate what influence low melatonin level have on the respective illness. Alzheimer's disease. There seems to be a clear correlation between Alzheimer's disease and a low level of melatonin. There are 694 research papers on that topic alone. Melatonin and cancer. There are many published studies on that. We get 3,190 results, and even the NIH confirms that melatonin is a very promising molecule for various kinds of cancer when it comes to treatment as well as for protection. Melatonin and depression. When it comes to depression, we get 1,928 results, and they confirm that most people with depression have also low melatonin levels. Melatonin and the heart. People who get a heart attack have low melatonin levels. We can study this over and over again. There are 1,078 published papers on that. Melatonin and virus infections. There are 205 scientific papers published on the C virus and melatonin. In fact, it is old news that many hospitals around the world use higher dosages of melatonin to safeguard their nurses and doctors. In this paper of PubMed it says that serum levels of melatonin are significantly lower in HIV-infected individuals. Melatonin and HIV, AIDS. This one is very interesting, because Dr. Hartner says here that he has treated HIV patients in his clinic with big success using 200 milligrams melatonin as a suppository. If you know someone in this situation, maybe you want to forward this video. We put a link in the description where he can contact Dr. Hartner. I have already treated HIV patients with good results using 200 milligrams melatonin suppositories.
Sowas geht dann auch.